All right. So first point is let's go over intramuscular injections, and so we have three different sites where we can put them. And this would be, they would apply for a child or for an adult. It would be in your deltoid, it would be in your vastus lateralis, and it would be in your ventrogluteal side. And for the deltoid muscle, we would, the needle length, it would be 5/8 to an inch, and the needle gauge would be 23 to 25. And for the vastus lateralis, that would be, the needle length would be 1 inch to 1 inch to a half, and the needle gauge would be 19 to 23. And for the ventrogluteal, needle length 1 inch to 1 inch and a half, and it could be, that could be up to 3 for a large adult. And the needle gauge would be 19 to 23. And for the intradermal injections, same thing, child or adult, it would be in the forearm, so it would be like right here, and that would usually be for like when they test for allergies, or a better example of that is tuberculosis. And the needle length for that is 5/8, and needle gauge, well, 5/8 to 1.5 inch, and half of an inch, and needle gauge would be 25 to 27. The subcutaneous, for either for a child or for an adult, the two sites where you can do that is in the abdomen, lower part of the abdomen, or the lateral posterior upper arm. So then that would be like right here. And then the needle length for the one in the abdomen and the one over here too, they're both the same. Needle length is 1/2 of an inch to 5/8, and the needle gauge would be 29 to 31. So that's for older child and adult. And for newborns, specifically, there's two types, or they're classified into two. It would be for the newborn less than 2 years, the ones that can't walk, since they haven't developed a lot of muscles. The only site that where you can really put an injection is in the vastus lateralis muscle, which is like right here, because like the deltoids are not like fully developed or anything like that, because they're just too small. The needle length for them would be 5/8 to an inch, and the needle gauge would be 23 to 25. For the infants, for the small child, basically, it would be the ones that are already walking or greater than 2 years. They have the same sites as an adult, so it would be your deltoid, it would be your vastus lateralis, and it would be your ventrogluteal site. And the length for that is, or the length of all of those three injections are 5/8 to an inch and a fourth, and then the needle gauge would be 23 to 25. So that's all of that. And yes, identify the sites. So for the sites, let's start with the deltoid. So you have your deltoid, you have your bone right here. So you basically go 1, 2 fingers, and you go right below it. So like it would be right here, right here. That's how you do that. For your vastus lateralis, I guess I could show my leg. You can have my leg, and then I guess it would be from this angle or vice versa. But it's basically right here. Put your hands, and it would be right in the middle. For the ventral gluteal. I'm not going to show this one, but that would be in your glute. And it's basically all you want to do is you want to put your hand and the crest, so like right on top of that, and then you want to put your middle of your hand, so like this right here, you want to put it in the femoral joint, so like right there. And then you would want to put your hand like that, and then you want to injection would be like right there, and that would be once again in your ventral gluteal. So that's how you find that. And yeah, let's move on to the next one. Explain the importance of a filter needle. All right, so a filter needle is basically it's, I don't have to do this exactly, but it's like this right here, and then all it does is we use this to draw medication from this little guy, which is an ampule. Correct? Yeah, I believe that's what it's called. Little ampule of medicine. And so basically, it's whenever we have to draw some medication from here, we would have to break it. We would have to put on some gloves so we can grab some grip. We would have to put something else around it, and then we would break it. And then so during that process, there's a little glasses that could spare off and just go into the medicine. And then so all it does is that we use this safety needle, or we use this filter needle to filter the medicine, and then so that it just ensures that there's no particles of glasses in the medicine, because we don't want to basically give glass into our shot. Because that would be just not good for the patient and for us. And so yeah, that's the purpose of that. Next, let's move on into how to reconstitute a medication. This is the fun part. Okay, so for that we're gonna have a drug. We're gonna have a dry drug, and then we're gonna have some lidocaine or water or saline over here. I'd say for now it's saline. Why not? And same thing. We're gonna come in. We're gonna wash your hands. We're gonna use hand sanitizer, whatever you want to do. We're gonna put on some gloves, and then we're going to, we have gloves on. We're going to grab this little guy and just clean off the top, get it sterile, get it clean. And then we would do that for 10 seconds in each, and then we would wait another 10 seconds, and then make sure those 20 seconds happened. And then after that, once it's clean, once we've waited, we get to, so we would put the syringe, and then we would grab it out, and then we're gonna draw. So my syringe is the 5 milliliter. So for this, we're only gonna draw 3, and then so before we do it, I'm gonna draw 3 of air, and then just gonna put that there, and then we're gonna draw those 3 that we just put in there back right up. Nice, beautiful. And then we're gonna grab that and then just put it right here. Boom. And then we would dispose this in the sharp container, right, proper way. And for now, I'm just gonna put it here. So that's disposed the right way. And then yeah. Then now we get to mix this little guy. and wow, it's very yellow. But in real life, or I guess in a real scenario, this would have to be clear. It wouldn't be like this. So it's yellow, but it should be clear. So yeah, that's how you do that part. So now, dispose the gloves, all that good stuff. And next one and last one, how to properly mix regular insulin with NPH insulin in one syringe. For that, we're gonna have to, we have two insulins. One's regular insulin, which is the short acting insulin, and we have the long acting insulin, which just takes longer, to absorb. So for here, same thing. We go wash your hands, hand sanitizer, put on some gloves. We come in here. Same thing as last time. We want to clean the top of it for 10 seconds. Clean the top of it for another 10 seconds. We wait another 10 seconds. And then for this we're going to be mixing 10 units of long-acting insulin, which is this right here, 10 units of that. And then we're going to be mixing 5 units of regular insulin, or the short-acting insulin. And so for that, we always have to make sure we draw the short-acting of insulin first. And then we want to draw the long-acting insulin. So that way it doesn't interfere, or it doesn't defeat the purpose of the short insulin being injected first, basically. So we have our needle, syringe, and this specifically for insulin. So do this careful. Let's do 10 units of just 10 of air into the long-acting insulin, which is this one right here. And then we have to do 5 units or 5 of air into the short-acting. There you go. And then we have to draw 5 units from it now. So there's 5 units. And then draw 10 units from this. There we go. Equivalent of 15 units. And for this, we have to put the safety mechanism so we protect ourselves and our patients. And yeah, I would put this back in here, and then I would label this. And yeah, I would just do hand hygiene, and that'll be everything.